Okay, so what's homeostasis? We talk about all the examples and the definition and all this stuff. So the definition is homeostasis is the maintenance of a constant internal environment. So examples would be maintaining blood glucose, body temperature, blood pH, blood pressure, blood sodium, blood potassium, water balance, osmolarity, on and on and on and on. And obviously we can talk about those things. Here's a quick example of how this actually works, because we use all these terms in the physiology course to talk about a receptor, and they talk about an effector, and they talk about a control center and all this stuff, and just these terms, and what do they mean? I don't know. Well, here you go. Here's an example. So blood pressure management. I'm not gonna go over all the details. We'll make a video later on that, but how would this work to control your blood pressure? Okay, at rest, because we talked about how if someone's exercising, well, your blood pressure just goes up, right? Systolic blood pressure should increase. That's normal. We're talking about somebody at rest. Normal blood pressure technically is less than 120 over less than 80 if you look at the AHA guidelines, but let's go beyond that and just say 120 over 80. That's your patient's blood pressure. How does it stay in that range, or how do we maintain that just from a minute to minute basis? So okay, what happens here? We start with a sensor or a receptor. So that's the term, sensor or receptor. We have special receptors in our carotid artery. So where the carotid artery splits here, so here's your heart, here's the aortic arch, and off the aorta, you're going to have your common carotids that split into the external and internal carotids and all that stuff. But that's not important. So at the bifurcation of the carotids, we have these special cells called baroreceptors. That area is called the carotid sinus. This is where your body can actually measure your own blood pressure. Like we use a cuff, or you have to use like an arterial line or something. Clinically, well, guess what? This is where our internal blood pressure monitor is. And then there's nerves connecting to those receptors, sending the signals about how much pressure is in the aorta, how much pushing. So these are mechanoreceptors, right? How much push is inside the internal wall of the carotids. That's going to come back to the control centers in the brainstem. So cranial nerve number 9, glossopharyngeal nerve, brings that information back. So receptors here, okay, your sensors, receptors here, comes back via nerves, the cranial nerve number 9, glossopharyngeal, and the control center. So what's the control center? Well, in this case, all of our cardiac and vasomotor control centers are in the medulla of the brainstem. So it's my very poorly drawn brain and brainstem, but midbrain pons medulla, we have all these areas of neurons there. So the cardiac centers and the vasomotor centers. So cardiac centers control the heart, vasomotor centers control usually blood vessel like tone, like how constricted they are, how dilated they are. So based on that, well, we're going to have these effectors. The effectors can be either the heart or the blood vessels. So here's an example. So that's our receptor, our sensors, the baroreceptors, and our carotid sinus. The control centers are brainstem and the medulla, where we'll have our vasomotor and cardiac centers. And the effectors can be a heart, and it can be our blood vessels, the arteries mainly, right? So let's say my blood pressure is too low. Okay, it's starting to go a little bit low. Well, that there's less stretch in the baroreceptors, so there's less of that signal coming back to the medulla, the control center. So control center can do two things, right? One of two things. And really what it can do is say, oh, one way to raise your blood pressure is to increase your cardiac output. So we can stimulate the heart with sympathetic nerves and tell the heart, hey, beat faster and squeeze harder, right? That's what the sympathetic nerves do to the heart. It's called positive chronotropic and ionotropic effects. We can also say, hey, let's constrict the blood vessels. Can we constrict the blood vessels, make them smaller? That'll increase the pressure as well. So we'd say, okay, I'm going to raise the blood pressure up, make the heart rate go up a little faster, try to make the heart beat a little harder. The arteries can squeeze a little tighter, and that might raise your blood pressure. There you go. Those are the effectors. Now, if blood pressure is going a little too high, we want to lower it. Well, they're saying there's more signal coming back to the medulla here. Well, we can say, okay, we need to do the opposite. So we inhibit these sympathetic nerves. By inhibiting them, right, they would not speed the heart up, and we would not constrict our blood vessels as much. The blood vessels would relax by inhibiting these nerves. They relax and they dilate a little bit. Okay, that would something called our peripheral resistance. So we decrease our peripheral resistance. And if we stimulate this nerve, the parasympathetic nerves to the heart will actually slow down. So this is a little more complicated. When we get to blood pressure, I'll hash all that out because we have to inhibit one and stimulate the other. But the bottom line is blood pressure goes too high. Well, there's the receptors, medulla, the brainstem, the control center. Effectors are the heart and the blood vessels. Again, it's too high, make the heart slow down, make the blood vessels dilate. It gets too low, make the heart speed up and beat harder, and make the vessels constrict. That's just an example of a homeostatic mechanism that your body's using all the time. So we talk about those terms, sensor, receptor, control center, and effector. Well, that's how it works in real life.